reverse and prevent years of aging with one of my favorite non-invasive treatments. I am 46 years old and I've had this treatment several times throughout the years. This is my main secret to maintaining a youthful look throughout the decades. In this video, I'm going to teach you all about Thermage and how it can be used to reverse and prevent aging through a process known as collagen banking. If I could only choose one non-invasive treatment for a non-surgical facelift, this is the treatment that I would choose. Are you guys ready? Let's get into it. Hi my beauties, greetings from beautiful Turks and Caicos. I wanted to hop on here and do a video for you guys on Thermage. What is Thermage? How does Thermage work? Is Thermage right for me? Does Thermage cause fat loss? All these questions that I've been getting. So I'm coming to you from Turks and Caicos on a family vacation. We've been on the ocean just playing all day. So I'm a hot mess in mom mode right now, but I just wanted to get content out to you guys every week. So what is Thermage? Thermage is an energy-based device that uses heat in the form of radio frequency to stimulate the fibroblast cells, which are the collagen-producing cells, to make collagen in the skin. And by inducing collagen synthesis, it helps lifts, tighten, and pulls, usually on the lower face. It's commonly used for a brow lift. It's commonly used on the neck and other areas like around the eyes to help tighten and smooth skin. And the mechanism of action in which it works is by stimulating collagen and elastin synthesis, which gives skin that textural turgor, that tightness and that smoothness. As we lose 10% of our collagen each decade, we start to lose collagen as early as our early 20s, and it just progresses as we lose 1% of collagen each year or 10% of collagen each decade. So doing procedures that can enhance your body and your skin's own regenerative processes to increase collagen stores, to undo the kind of laxity, fine lines, wrinkles, and changes that we see with collagen loss, the opposite is true when we stimulate collagen neogenesis and elastin neogenesis. Collagen and elastin are the extracellular matrix proteins that give skin that smooth, tight, bouncy contour, and we lose it as we get older. But we can counterbalance that by doing treatments in office that are non-surgical to increase those collagen stores. So that's why I'm a big proponent of energy-based devices that can stimulate collagen synthesis and tighten the skin from within. So what is my experience with Thermage? As a patient, I've had Thermage when I was 30, 35, 40, and 45 years old, and I've had it done on my lower face, on my neck, and under my eyes. And it is honestly one of the best things that I think I've done personally to help keep collagen stores up in my skin. And I did it when I was in my early 30s, when I was 30 years old. And the reason why I did it is because I remember learning about collagen banking as a phenomenon in residency and medical school. And what happens is when you increase collagen stores, you have stores and reserves of collagen that are higher. So as you age and you lose collagen, you're kind of staying in the same place, or you're gaining some and you're losing some. So you kind of stay in the same place in a standstill within the aging process. So that's why I did it when I was 30 years old, and I've done it about every 5 to 6 years. So when I did it at 30, I did around 35, and then 40, and then 45, and I'm now 46 years old, and I feel like it's one of the best things that has kept my lower face rejuvenated over time, and my neck as well. And you can see in my older YouTube videos where I kind of took a lapse and I had a toddler and a baby, and I was working 80 hours a week as a Mohs micrographic skin cancer surgeon, and I just didn't have time to put that self-care time into myself, and I kind of let it go like 6 or 7 years. And then once I did the Thermage, and I also did thread lifts in my neck, it kind of just brought me back. And I feel that this is one of the best things that I've done personally as a 46-year-old mom of 2 kids with a very demanding, high-stress career, that I've been able to do for myself to keep my collagen stores up and to keep especially the jawline and lower face nice and smooth and tight, and especially to keep the under eye area nice and smooth and tight as well. So next question, who is a good candidate for Thermage? Someone who is not ready for surgery or wants to have surgery at a later time, but just wants a little tightening improvement on their skin. And usually it's people who have lower face jowls or lower face laxity, a little bit of crepiness or laxity in the neck, or under eye wrinkles or fine lines, or when they smile they start to see those changes but they're not ready for surgery, or sometimes people who have hooded eyes, or what we call dermatochalasis, when we have a little bit of hooding or ptosis of the eyelid, people who want just a little extra extra lift in their brow, but they don't want surgery or they're postponing surgery. A lot of surgeons will do a fear-mongering technique. I don't feel that it's ethical or right for surgeons to say Thermage will make you not a candidate for having surgery later. And this is why. I've done multiple fellowships in dermatology, and I did a skin cancer Mohs micrographic surgery fellowship where we're looking at skin under the microscope, where we're excising the tumor, we're looking under the microscope to make sure that the cancer is clear, and then we do the reconstruction of the face, the neck, the ears, the lips, other places on the face where we have to do reconstruction. We're pretty much doing the plastic surgery, reconstruction surgeries, where we're doing flaps and grafts and advancement flaps and rhombic transposition flaps and moving around skin and tissue. As a surgeon, I can say I've never encountered a problem with a patient who has had Thermage. Because I practiced in a cosmetic clinic most of my career, I've usually done Mohs skin cancer surgery on patients who have had Thermage, andal therapy, and Sculptra, and all of these procedures that surgeons say, well, once you have these procedures, you have scar tissue and you can't be a candidate for surgery. That's absolutely not true. And again, I could speak as a dermatologic surgeon who has done thousands and thousands of reconstruction, flaps, grafts, repairs, and cosmetic reconstructive surgeries on patients who have had all these treatments that surgeons say, if you have these treatments, you're not a candidate. So those surgeons want you in the OR. They want to operate on you. They don't want you spending money on non-surgical interventions, which are much less expensive than a $150,000 facelift or neck lift. They want you in the OR spending money on that. And I feel that that's unethical, so I can speak as a patient, as a dermatologic surgeon, and as a procedural dermatologist that is absolutely not true. I'm just realizing I have this ridiculous bun in my hair, but you have to understand I just jumped out of the water. I just jumped out of the ocean 2 seconds ago. P.S. It's 80 degrees in the water and in the ambient temperature. It's beautiful. Okay, let's move on. I get distracted. Another fear-mongering tactic that a lot of people say is that Thermage melts fat, or Thermage causes facial atrophy, or Thermage can thin the skin. Now, there's a twofold component to this statement. Thermage has been around for a long time. It's been around since I was in medical school, back in the 2005, 6, 7 era. And it's like the iPhone though. Even though it's been around a long time, doesn't mean it's an old device. They continually improve it. It's like the iPhone 15 versus the iPhone 13. It's a totally different platform, totally different device, and it gets updated with technology as the years go on. But the earlier models could melt fat. They could get cranked up to high temperatures where they would actually cause fat atrophy. You have to understand the physics behind how these devices work, and you want to be in a collagen stimulation window of temperature, and it's a somewhat narrow window that you want to be in between. But people who don't know better will numb their patients so the patients can't feel it, crank up the device, and go exceed those temperatures where they're not even in collagen stimulation temperatures, but they're in fat melting temperatures, which is not good. So what you have to do is tone it down, not get it too hot, not numb your patients, because you want that biofeedback. Trust me, if you're a patient getting Thermage and if your fat is melting, you will be able to smack their hand away and be like, ouch, this hurts, get off of me, stop this. But when the patients are numb, when they have nerve blocks or when they have numbing cream, they don't have that interaction to tell the provider, hey, it's too hot, turn it off. So if you're having Thermage done by a provider who is very well trained with a new device with the most updated software, fat melting should never happen. Now, does it happen? Yes, but it's usually in the hands of an unskilled provider, and the first red flag that you can tell if someone's unskilled is if they numb you, because everyone who's been trained appropriately knows that you're not supposed to numb your patients. Because if the patient can't tell you it's too hot, then they could get into fat melting territory and they wouldn't be able to tell you to stop, tell the provider to stop. Second is that a lot of third-party laser brokers try to buy and sell devices and they swap out parts. There's a whole black market in aesthetics where lasers that are usually $250,000 will be on the black market for $20,000. And people who are trying to cut corners, that's why all these medi-spas are hurting people and going out of business, and they have a bunch of first-time patients but nobody who comes back. That's why they have to rope you into a package. They'll buy old refurbished machines. They'll buy a $20,000 Thermage from 2005 as opposed to the premium FLX platform from 2024, which is the year now, in case you guys are watching this years from now. But the software has been updated so much to an extent that fat melting temperatures aren't even achievable. So you want an expert provider who really is well trained on the Thermage device, how it works, the physics of it, how to heat stack, how to do their vectors, how to map it all out, and how to read the patient's biofeedback to know when they're too hot or when they need to move on to a different area. So if you have someone who doesn't know what they're doing with a cheap, refurbished, Medi-Spa device, I'm not calling out Medi-Spas, I'm sure medical offices, there's some medical offices who are too cheap to pay the overhead for a advanced machine that's the newer updated software and the most advanced technology. Combine all these factors and yes, you can melt fat, but that should not happen when it's done appropriately. Hopefully that clarifies things for you guys. I just see the good, the bad, and the ugly, and I'm just the messenger here. And again, I'm non-sponsored. I'm not sponsored by Thermage or Solta, which is the manufacturer of Thermage. I just really like the device, and I've been using all the devices known to man, and plus some that have not even been FDA approved or launched yet, for the majority of my career as a cosmetic dermatologist and laser specialist for the last 15 plus years. So to answer the question, does radio frequency cause facial fat loss? The answer is no. What to look for if you're considering Thermage, and that is a provider who really understands the platform well, who has gone through extensive training. It doesn't have to be a fellowship trained laser surgeon or dermatologist. It could even be, an extender or nurse practitioner or a provider who has gone through training by the company. And that's another thing. When an office or a medical office or a Medi-Spa buys the new machine, the Thermage device from the company, you get the company to directly come and train all your employees. If you're getting a third-party laser broker who's swapped out parts and is using the device from 2005 that's going to melt your fat, they're not going to even train you. It doesn't even come with like a warranty or training or help from the company or assistance and guidance from the company, which is like sets providers up for disaster when it comes to harming patients, not getting results, and having complications like fat loss and fat atrophy. Now, why would someone not see results from Thermage? A provider who wasn't doing the treatment right, for example, there is a handpiece that comes on the Thermage device that has 950 pulses. I've gone into spas that were having trouble with respect to complications and getting good results, and I could see the mistakes that they were making and what they would do to cut overhead, because a Thermage handpiece costs about, anywhere from $600, $700, $800. So to cut costs, they would take the same handpiece and use it on 3 different patients. So instead of having 950 pulses on each individual patient, they'd be getting between 300 to 400 pulses on each patient or less, which is going to make you not have as good of a result. Also, if they spread it too thin, if they go from like your forehead to your neck and you're spreading those 950 pulses over the entire neck and face, it's not going to pack a punch. For example, in our office, and not to give too many of our secrets away, but I always concentrate on the troublesome area, and it's usually this area on people. So we'll put all those 950 pulses from like the mid face to the upper neck and just concentrate it right in that area, and that's how we get that sharp defined jawline. Every office probably has a different protocol. These are just tricks of the trade, things that I've learned in my laser fellowship training, where we had to do thousands and thousands of these cases, and you learn a lot by doing these proctored treatments with a expert behind you, breathing down your neck, watching every move you made, asking you, questioning every choice that you make as a provider, and that's where you get that amazing training. But we are few and far between, so it doesn't have to be a fellowship trained laser or device dermatologist, but just make sure that your provider is well versed with how to use the device, use the updated software and technology, and just use one handpiece per person. Don't spread it too thin and cut costs. A lot of offices do that. I would never. How many Thermage treatments do I need? And that's a great question. That's a question that comes up a lot. And honestly, only one. Only one treatment is needed. And I know that the data may show different things, and different offices or doctors will recommend different things. I've had patients come in and say, I went to another office and they said I need a Thermage every 3 to 6 months. No, you only need it once. And I say you only need one treatment, not more than one. And usually the results last anywhere from 5 to 6 years, because the half-life of the collagen that gets stimulated is about 5 to 6 years. I have to show you guys the sunset because it's just beautiful. This is like not a green screen. This is like real life. Look how beautiful that is. And it's like 80 degrees out. So beautiful. And the sun is setting, so we're on limited time here. When will I see results from Thermage? Now, that's a great question. There is a delay. So just like if, this is a bad example, but say you burned your hand on a curling iron, the skin will respond, but it takes weeks and months sometimes to form the scar, or to form the collagen synthesis, or to form the skin changes that happens from that stimulus, which is, say, a burn, for example, and the result. So Thermage is a very controlled wound healing situation. Now, when plastic surgeons say, oh, it causes scars, scar formation is a lot of collagen. So anything that's going to stimulate collagen is inducing scar formation, whether that's a tretinoin, a laser resurfacing, drinking your collagen peptides, any microneedling or energy-based device, all of these things, chemical peels, they stimulate collagen. So yes, that is scar formation, but that's not the type of scar formation that's the keloidal plaque-like hypertrophic scars that are going to, make you not a surgery candidate or deform the skin. Oh my gosh, you have to look at this. The sunset is so beautiful. I get so distracted, but it's so beautiful. I just lost a fan. My eyelash extensions are falling out as we speak. I swear when I go to vacation, I come in looking pretty good. My spray tan's on point, my lashes are full. Now at the end, I'm all beat up. We're actually going home tomorrow. We've been here for 8 days, so I'm a hot mess. But look, I'm dedicated to you guys. I don't stop the content coming. Okay, where was I? When will I see results from Thermage? There's a little delay between the time of treatment and the results. The results usually start to show 2 to 3 months after the treatment. So for like a month or two after treatment, you're gonna forget it ever happened. There's no downtime, there's no limitations. You can get your Thermage treatment and go straight to the gym, work out, do HIIT, do push-ups and whatever, and it won't affect your result. There's no downtime, which makes it amazing. I always tell my patients to drink collagen peptides because your skin cells are upregulated to synthesize new collagen. So by giving them the building blocks to do so, I feel like it augments your response. It's like going to the gym and then eating your protein and eating clean. They kind of augment the results. So when you do your Thermage treatment, I usually have my patients drink collagen peptides. I love the Vital Proteins collagen peptides, the bovine ones. I put them in my smoothie, my tea, my coffee. I usually do 1 scoop in the morning and 1 scoop at night. And my Thermage patients, I recommend that they do this as well. And also know that there is about 2 to 3 months between the time of Thermage treatment and when you'll see results. And then results will continue to improve to up to the course of a year. Usually I'll have my patients come in at 3, 6, 9 months and 12 months to see the results, and we're looking at before and afters, because when you're looking at yourself gradually every day in the mirror, you're not going to appreciate those changes. But when patients come in for snapshots in time to see the results, you definitely will see the results from the Thermage, and it continues to improve to up to the course of a year, because even if you look at a patient at 9 months post Thermage and 12 months post Thermage, there's an improvement between those last 3 months. I remember when I had Thermage for the first time, I was getting my hair done and I had my head back in the washing shampoo bowl, and it was like super tight. And then like when I reached up to kiss my husband, I'm like, oh my gosh, I felt that tightness on my neck, and I was like, ooh, here we go, it's coming. So you'll notice that 2 to 3 months after your Thermage treatment, and it continues to get better. What to expect in a Thermage treatment, and is Thermage painful? So Thermage should not be painful. Again, you shouldn't be using numbing or numbing cream. If your provider offers numbing, say no thanks, because you don't want the provider to achieve hot temperatures, which hopefully they're using the updated platform that doesn't go too high, and hopefully they know where the window is that they need to be in to stimulate collagen but not get into fat melting territory. And hopefully if you're not numb, and if they crank it up too high or it gets too hot, you can have the biofeedback to say, hey, it hurts, can you turn this down? Because if you're just numb and you're laying there and they're cranking it on and melting your fat, that's when you get into trouble. So Thermage shouldn't be a painful experience, and there shouldn't be any downtime, and there's only one treatment that's usually needed, and usually it's recommended every 5 to 6 years. Let's talk about Thermage for jowls and Thermage for jawline. Again, it's my favorite area, probably the most requested area to do Thermage, and the way we do it in my office is we go from here to here, and we just really focus on that area. Now, it just depends on how thin the skin is, the patient's age, and the amount of laxity, and that will determine how well they respond. Sometimes we'll add in a little bit of jawline filler or a little bit of filler in the chin area, or we'll combine it with a little bit of Kybella to melt submental fat and fullness. Thermage isn't really FDA approved to be a fat melting device, but when you combine it with a fat melting procedure like Kybella or a liposuction, if you're a plastic surgeon's office, it can really enhance the results. Thermage for non-surgical facelift. Now, as a surgeon, I always want to be very clear, these non-surgical options and treatments are by no means surgery. It is not a deep plane facelift. Really managing expectations for my patients, it becomes of the utmost importance to me. So it's going to tighten, it's going to improve it, but it's not going to give you the extreme results that surgery would. But the flip side is it's not as expensive, it's not as scary because you don't have to undergo general anesthesia, and it's fairly safe when in the hands of a skilled provider with the updated software. I just really want to be transparent with that, because most of the treatments that I do in my office as a non-surgical cosmetic dermatologist is just to buy people time, or for people who don't want surgery, just things that they can do over a lifetime to keep their skin looking their best for their given age. Another question that comes up is if I'm 70 years old, or am I too old to stimulate collagen? And that's not true. We can induce collagen synthesis in anyone. I will say that if someone has been getting Thermage starting maybe in their 30s or 40s, in their 50s and 60s, they're going to be more responsive and sensitive to the results of Thermage than someone who's not done Thermage. And the reason why is because the melting point of the collagen that gets synthesized by Thermage is a lower melting point than regular collagen. Say you see a woman who's in her 50s or 60s at the gym and she's totally ripped and she has these buff arms. She didn't just start working out in her 50s or 60s. She's probably been working out and conditioning her muscles to respond to the stimulus of exercise her entire life. Same with eating clean, same with living a healthy lifestyle. That starts to catch up to you. And now that I'm 46 years old, I'm glad and I can appreciate the fact, well, wow, I've been doing these, rejuvenating treatments on myself since I was in my 20s. I wasn't doing it intentionally for non-invasive rejuvenation treatments. We were basically just using each other as guinea pigs, as residents in the laser lab at UCLA, but we were inadvertently and unintentionally giving ourselves anti-aging treatment. That said, someone who is 46 like me, who's been doing Thermage since she was 30, is going to respond better in her 60s than someone who has never done Thermage before. And it all has to do with skin conditioning. Just like the musculoskeletal system gets conditioned, just like the immune system gets conditioned. It's a lifetime of habits. That's not to say if you're in your 60s or 70s and you want to have Thermage, you're not going to get a response. You just will get maybe less of a response than someone who started a little bit younger. So I hope that makes sense and clarifies any misconceptions. Also, there's some people who respond a lot better to Thermage than others. I had this woman who was, I think, 74 years old, and she came in. She was a very fit, athletic woman. She ate clean, but she really hadn't done much for her skin in her lifetime. She's never had surgery. I don't even think she used any medical grade skincare, but she came in and wanted to start taking better care of her skin and herself. And she did a Thermage, and she just responded like so well. I should probably, if I can get a picture, post it of her. She responded so well just to one treatment. Everyone's different with how they respond, but everybody responds to Thermage to a certain extent. Whether you're going to get a 15% improvement or 45% improvement or a 60% improvement, it just can vary with the patient. But it's always good to try. And if you are a responder to Thermage and you respond very well to very little, then that's something that you probably want to put on your rotation every 5 to 6 years. Thermage for neck. Thermage for neck is one of my favorite tightening devices for the neck. Now, sometimes we combine it with other therapies. I think the biggest improvement I've ever had personally was when I was in my late 30s, going into my early 40s, and I kind of fell off the wagon treating myself because I was so busy with my career and treating patients, and with two kids under the age of 5, I just really let myself go. So I did a Thermage treatment, and I added in PDO threads, and that really gave me a really good improvement. So I really love Thermage for the neck. Sometimes we combine Thermage with Fraxel, which we call Thermofrax. Sometimes we combine it with threads, as we did with myself. And sometimes we'll combine it with Kybella or fat melting injectables to kind of enhance the response. But there's lots of different things that we can do, and sometimes it's a combination of these non-surgical interventions to give the best results. Thermage for eyes. So Thermage for the eyes requires two things that may be hard to find when you're looking for a provider. One, you need to be able to have a provider who knows how to insert an intraocular eye shield. An intraocular eye shield for Thermage is imperative. You can't do the treatment without it. So it's like a large contact lens that goes into the eye. It's not anything to be afraid about. Usually we put some tetracaine, little numbing eye drops in the eyes. We insert the protective eye shields, and then we do the Thermage treatment. It's not painful. It doesn't hurt. It's just kind of like having a big contact lens in your eyes to protect the globe of the eye. A lot of providers are not skilled with providing that protection for the eye. They don't know how to put an eye shield in. So if you go to a provider for Thermage for the eyes, say, do you guys use eye shields to protect the eyes? And if they say no, we don't really recommend Thermage around the eyes, let me translate that for you. It's probably they don't have the specific handpiece that's needed for eye treatment, or they don't know how to put in an intraocular eye shield. It took me like years to get good at putting in intraocular eye shields. I've been doing this for over 15 years, and it took me a while to get good at it. So if you can find a provider who knows how to put in intraocular eye shields safely and effectively, then it's one of the best treatments for under eye rejuvenation. I've had Thermage under my eyes about 4 times. And I just jumped out of the ocean. I don't have any makeup on, residual lash extensions, and some smeared eyeshadow. The other thing that you need for eye treatment with Thermage is a specific eye handpiece. Now, the handpiece for a Thermage eyelid treatment is different than the one we use on the face. that dermis is thicker, the subcutaneous targeted area is thicker. So the Thermage handpiece for the eyes is really tiny because there's a little radiofrequency arc that has to go from one pole to the other. And when you're using the face handpiece, it's a larger arc that has to go deeper. So for the eyelid handpiece, it's a smaller tip because the arc of radiofrequency is going to be more shallow and tinier because of that delicate thin eyelid skin, as opposed to the skin on the face that's going to require an arc of radiofrequency that's larger with a larger handpiece for the face. Okay, sunset update. You guys look at it now. Ooh, it's so pretty. Thermage for nasolabial folds. So Thermage can help lift from behind and pull up on nasolabial folds. There's also other treatments that I like for nasolabial folds as well. Sometimes we combine Thermage with a little bit of filler in the nasolabial folds, but a lot of my patients don't like filler, and I don't blame them because we just are coming out of an epidemic with people with overfilled faces. Elocore is a microcoring technology which we use for nasolabial fold correction as well. But Thermage is one of my favorite starting points to help correct nasolabial folds as well. But there's threads and there's Elocore and there's filler and there's lots of other things too. But it is one of my go-tos for correction of nasolabial folds. Thermage for body. Thermage for body requires a different body tip, but I've learned along the way that using the face tip for body treatments actually works a little bit better, especially like inner arm here where people get crepey skin, or abdominal skin laxity after having babies. Thermage is a great treatment. I often combine it with some type of biostimulatory injectable like Radiesse or Sculptra, and also Elocore off-label for microcoring skin tightening on the abdomen in combination with Thermage works really well too. We've been getting great results for that off-label. Okay, you guys, so we went through a sunset together. It is now nighttime. My family is all ready to go out to dinner, and I'm still all oceany with saltwater hair and no makeup and have to get ready. So thank you guys so much for spending this time with me. I'm glad I was able to get a video out despite being on vacation with the fam. Drop a comment in the comment section if you have any questions or if I missed any topics pertaining to Thermage. Also, let me know what you want to hear about next week, because I see you, I hear you, and I want to be really receptive to what you guys want to hear about. Again, I'm non-sponsored. I'm a board certified dermatologist. I've never taken a paid partnership, so everything that I recommend on my channel is what I truly believe is best for my patients and for my loved ones and myself, and not because the company is paying me to do so. Be sure to subscribe to my channel because every month we have a giveaway of my MDR skincare products, and when we select the giveaway winner, it has to be someone who's subscribed to the channel. So thank you guys so much. I hope you guys are having a great afternoon or evening or night or morning, depending on when you're watching this. All right, I love you guys.